this is Carolyn Lidner, and this is my case study number 2. First, we will get into a quick review of the client. He is a 4-year, 10-month-old male diagnosed with autism spectrum disorder, or ASD. He's been in our ABA program and receiving speech and OT services for just over a year. I believe in last April he started. He's a vocal verbal child, but he still presents with limited functional communication and manding skills. He mainly scripts and says a few non-functional words. And then the behavior of concerns we'll be looking at today are self-injurious behaviors and aggression towards others. Here are some task list items that we will be discussing throughout this presentation. So we have a few listed here. I'm not going to read them word for word, but we have H1, H2, H3, H4, H5, H6, E2, and E7, which will be discussed in the presentation further. The client has been exhibiting 2 behaviors of concern, which are self-injurious behaviors and aggression towards others. So right now we'll go through the definitions and examples and non-examples. So for SIBs, the definition includes any successful or blocked action of the client that would cause physical harm to their own body from the use of their own hands, feet, or other objects. An example would include intentionally running into a wall, banging their head on the floor, or hitting themselves in the stomach with their hands. A non-example would include if they tripped over a chair or swatted a bug off their arm. The second behavior of concern is aggression towards others, the definition of this being any instance where the client intends to or physically causes harm to another individual by using their body or other objects. Examples of this include hitting, kicking, biting, throwing objects at another peer or adult, or any numerous other things. Non-examples would include throwing a ball to an adult while playing catch, or giving a peer a high five. To determine the functions of these 2 behaviors, we used the FAST assessment or the functional assessment screening tool, as well as collecting some ABC data prior to that. So basically the client's mother, as well as the client's main RBT, filled out this FAST questionnaire. Scores were tallied up, which led us to believe that the 2 functions of both of the behaviors actually were both escape and access to tangibles. Before we ran this assessment, assent was obtained by both the parents, both mom and dad, to not only just conduct this assessment, but also to use physical prompting strategies that were necessary to complete the assessment, as well as to ensure the client's safety, because this particular client does engage in, running into the wall or hitting himself, so physical redirection needed to be used sometimes, so we made sure to obtain assent before completing this assessment. The first behavior of concern that we will talk about is his self-injurious behaviors, or SIBs. So this client throws himself into the wall, and he also head and leg slaps. So his goals are that he will record 0 instances or attempts of throwing himself into a wall for 20 consecutive sessions. His other goal is that he will record 0 instances or attempts of head slapping or leg slapping for 20 consecutive sessions. And his last goal will be he will record 2 instances per day of hitting his lap pillow instead of hurting himself for 10 consecutive sessions. His proposed interventions that will be implemented after assent are differential reinforcement of alternative behavior, functional communication training, a visual schedule, and then the PREMAC principle. The DRA and FCT are the 2 main interventions right now, but then a visual schedule and the PREMAC principle will be used in combination to just better support this client. And we will talk about those more in a second. Now we can look in a little more detail about the proposed interventions for this client's SIBs. So for his replacement behavior, we will reinforce him. So he will have a skeleton lap pillow, because he loves skeletons, sitting either on his lap, on his desk, just wherever he is, ideally in between the instructor and the client. When demands are placed, when a transition is happening, really at any time it should be by him. And we would redirect any, self-injurious behavior attempts to the pillow and then reinforce when the client uses the pillow. Eventually we will then fade the reinforcement out once he becomes more accustomed to this, but for now we will highly praise him anytime he uses the pillow instead of hitting himself or running into a wall. The next intervention is functional communication training. We identified the mode of communication as verbal language. Since he has a lot of verbal language, he doesn't use AAC or PECS or sign language or anything like that. So verbal communication is the best for him. And then we will teach appropriate words and phrases to replace the challenging behaviors. So again, the two main functions were escape and access to tangibles. So for escape, we identified the phrases "I'm all done," "let's go," and "I don't want" as appropriate alternatives. And then for access to tangibles, we identified "give me," "I want blank," and then "my turn" as appropriate alternatives. And then just additional supports for this client are visual schedules. We noticed that for this client, having a visual schedule laid out before he even arrives of when he's going to go potty, when he's going to go to speech, OT, group activities, really helps him throughout the day transition a little bit easier. And then as well as using the pre-MAC principle, if you clean up your skeleton, then we get to go to OT. Really definitely decreases the amount of SIBs we see throughout the day. Now we will look at the second behavior of concern for this client, which is aggression towards others, and this usually comes in the form of hitting, kicking, biting, and then throwing objects at others. The goals we identified for this behavior is the client will record 0 instances of attempts of aggression towards others, behaviors for 20 consecutive sessions. And then the second one is the client will record 2 instances per day of redirecting his anger towards his lap pillow for 10 consecutive sessions. So instead of, hitting or kicking somebody else, he will go to hit his pillow instead. The proposed interventions, the two main ones again, are the DRA and the FCT. And then the two additional supports are a token economy as well as the high probability instructional sequence, or the HPIS. This little picture is just like a little lap pillow that he's going to be using, since again he's very into skeletons. It's something a little more reinforcing for him to carry around and keep around him all day long. So now we will quickly go into a little bit more detail about the proposed interventions for aggression, which again would not be implemented until we have obtained assent from the parents and went through a proper parent training on these interventions. So the first one being differential reinforcement of alternative behavior, the alternative behavior being hitting a pillow or kicking a pillow rather than, kicking somebody else or throwing an object. So he would have his little skeleton pillow, he would keep it with him, and then once he felt, the anger towards somebody, he would hit his pillow instead of hitting somebody else. Just for, everybody's safety, at least for now, and then we can have him more appropriately communicate his emotions, his desires a little bit later, down the line. But for right now, just for everybody's safety, this is a more appropriate outlet for him. And then we would, of course, reinforce every instance of him getting his anger out on this pillow. The second intervention is still FCT, so replacing his challenging behaviors with appropriate words and phrases for his escape and access to tangible functions, which we discussed previously. The two additional supports that we're putting into place are token economies. So he's going to be working in a variable ratio 3 schedule of reinforcement, earning little skeleton tokens, so he has to learn to earn his reinforcement again. And then we will also be using the high probability instructional sequence. So we will deliver 3 to 4 high probability instructions or maintenance instructions for him, like clap your hands, tap your head, something he knows how to do before delivering, a harder instruction, just to build up some behavior momentum, and to build up his confidence a little bit. These interventions are evidence-based, especially differential reinforcement strategies, as well as FCT, token economies, high probability instructional sequence. They all have been researched and studies have been done. So I listed a few here, but it is definitely not limited to what I have listed here. Now we will look at the next steps for this client, which would of course be to carry out the interventions after assent has been gained from both parents. We will then train the parents, the RBTs, and any other shareholders that might be running these programs or these interventions with this client, and we will train them how to carry out the proposed treatments, just so there's treatment integrity and there's just cohesiveness across the board. We will explain the possible unwanted effects of the interventions. We may see an increase in the intensity of the behavior because the behaviors are not getting reinforced anymore, so he might increase the intensity of them to see what he can get away with. So we have to be aware of that, as well as we may see emergence of new behaviors because the old ones are not getting reinforced. So we should look out for any new behaviors that might occur. We should continue to record frequency data for SIBs and aggression both here and at home, and to monitor to see if there's a decrease. If there's not a decrease after a month or two, we should then reconvene about the interventions. And lastly, we should just be mindful about this particular client's diverse medical history. He does have a history of absence seizures that can be triggered by overstimulation, so we have to be mindful about about how hard we push him, how many demands we put on him, just so we don't trigger anything unintentionally. Thank you.